There's going to be a detailed lecture in this module on substance use disorders, but here we're just focusing on something a little bit deeper, and it's the link between trauma and substance use. And many people think of addiction as simply a matter of bad choices, lack of willpower, or genetic predisposition. But if we take a trauma informed approach, we see addiction as an attempt to cope with unbearable pain. Gabor Maté, a physician and an addiction specialist, argues that the question is not why the addiction, but why the pain. In nearly every case, substance use is not about the substance itself, it's about the underlying distress that the substance is trying to numb. Trauma survivors often turn to drugs, alcohol, or other compulsive behaviors because their nervous system is stuck in survival mode, and substances can provide a temporary relief from emotional pain, hypervigilance, or dissociation. Understanding this biological and psychological link between trauma and addiction is crucial for treating both conditions effectively. So, at the core of both addiction and trauma is the dopamine system, which regulates motivation, pleasure, and reward in the brain. When we experience something pleasurable, whether it's eating, social connection, or achieving a goal, dopamine is released in the nucleus accumbens, reinforcing that behavior. However, trauma disrupts this system in two major ways. The first way, trauma floods the brain with stress hormones, which hijack that dopamine system. That HPA axis, or hypothalamic pituitary adrenal axis, is overactivated, leading to high levels of cortisol and adrenaline that override normal dopamine function. This means that trauma survivors may struggle to feel joy, motivation, or connection in everyday life because their dopamine system has been hijacked by chronic stress and their body's just not providing enough dopamine. The second way is that substances artificially restore dopamine levels. So, drugs like opioids, stimulants, and alcohol provide a temporary dopamine boost, creating a sense of relief or euphoria that trauma survivors may not be able to achieve naturally. Over time, however, the brain adapts by reducing its natural dopamine production, leaving individuals dependent on substances just to feel baseline normal. And this is why addiction is not simply a matter of choice. When trauma has disrupted the brain's ability to regulate dopamine, substances become the only reliable source of emotional relief. And while dopamine is the neurotransmitter most commonly associated with addiction, glutamate plays an equally critical role in how addiction develops and why relapse is so difficult to avoid. Glutamate is the brain's primary excitatory neurotransmitter, meaning that it plays a crucial role in learning, memory, and habit formation. When a person experiences trauma, glutamate surges, strengthening associations between the traumatic event and environmental cues. This is why trauma survivors often feel triggered by sounds, smells, or locations tied to their trauma. They have a heightened glutamate response that reinforces those connections. In addiction, glutamate reinforces the drug seeking behavior. When somebody repeatedly uses a substance, glutamate helps encode the experience into long term memory, making the substance a learned survival strategy. Over time, this leads to drug related cues triggering intense cravings, even long after the person has stopped using. And glutamate dysregulation contributes to relapse. Even after detox, a person with an addiction can experience glutamate driven cravings because their brain has been rewired to associate substances with relief from distress. This is why simply removing the substances doesn't cure addiction. The brain must be retrained to respond to stress and triggers differently. So, by understanding the role of glutamate, we see why addiction is not just about dopamine and pleasure, it's also about deeply ingrained learning patterns that must be rewired for true recovery. And trauma not only leads to substance use, but also makes cravings and relapse more intense. Trauma enhances sensitivity to drug related cues. Just like trauma survivors are hyper aware of danger, they can also become hyper aware of substance related triggers. For example, if somebody used alcohol to cope with childhood neglect, simply walking past a bar can activate deep seated cravings because the brain has linked substances to relief from emotional pain. So, stress induced drug related behavior is also something we want to look out for. Trauma keeps the nervous system on high alert. And when stress reaches a breaking point, the brain automatically seeks relief. This is why people in recovery often relapse during high stress periods. Their brain is simply reverting to the most effective coping strategy that it knows. Breaking this cycle requires more than just stopping drug use. It requires retraining the nervous system so that safety, connection, and regulation can come from healthy sources rather than substances. So, one of the biggest challenges in treating trauma and addiction together is timing. If trauma is processed too soon in recovery, it can lead to relapse. Early recovery is a fragile time, and diving into trauma work can overwhelm a person's ability to cope, making substances seem like the only way to manage the distress. This is why traditional 12-step programs often delay trauma work until a person has built enough sobriety and stability. If trauma is never processed, the risk of relapse remains high. Unprocessed trauma fuels substance use, and if it's ignored, the deeper wounds that drive addiction remain untreated. Many people relapse, not because they want to, but because they don't have another way to regulate the nervous system. So, what's the solution? The key is balance. Early recovery should focus on stabilization, helping clients build healthy coping skills before diving into trauma work. Trauma processing should be carefully timed, ensuring that clients have enough internal resources to handle the emotions that come up. This is why integrating trauma sensitive approaches like mindfulness, breathwork, movement therapy, and EMDR can be powerful before deeper trauma work begins. So, some key takeaways: addiction is often a response to unresolved trauma. Dopamine and glutamate both play critical roles in addiction and relapse. Trauma increases sensitivity to cravings and stress related drug seeking. And trauma work and addiction recovery must be carefully timed to prevent re traumatization. Understanding the intersection of trauma and addiction is crucial because without treating the root cause, substance use recovery remains fragile. By addressing the trauma, we give clients a real path to healing, one that isn't dependent on substances for relief.